All right, good morning, everyone, and thank you for being here. This is Public Health and Minority Health Disparities Subcommittee. We have three bills on the docket today, so I'm going to try and get you in and out to give you back some more of your morning. But we have a couple of bills that we've heard and one that did not have a cross file. But I think is pretty straightforward. So we're going to start with the Senate Bill 163, which did not have a cross file. This is Health General Article, references to mental health. As you may recall from the hearing, this is simply updating the article with more current language. And Erin, if you can walk us through the bill.
So the bill replaces remaining references to mental hygiene with mental health throughout the Health General article. There's also uncodified language that requires MDH on or before July 1st, 2027 to conduct a thorough review of department regulations and adopt regulations to replace any reference to mental hygiene with mental health. And it also requires the department to update all public-facing electronic materials to be consistent with the Act as soon as practicable.
Thank you, Erin. Just to anyone watching the live stream, some of our members are off camera because they are in multiple meetings today, as is the nature of crossover or sine die, weeks leading up to sine die. But they are here. They are actively participating. So with that, do I have a motion on this bill?
Move the bill.
Second.
All right, it's been moved in second. Any further discussion? Any questions from the members? Anyone who wants to be heard? All right. It's been moved and seconded. All in favor say aye.
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 Anyone opposed? Go ahead and raise your hand in the chat. All right, thank you, everyone. Senate Bill 163 passes unanimously. We're now going to turn to Senate Bill 222. This bill was cross-filed. There was an addition. This is Public Health Cannabis Public Health Advisory Council membership. There was an addition to the members that was added in the Senate, which we think is reasonable. So Erin, if you can talk us through the bill and the proposed addition. And I believe, if I'm correct, that we're looking at passing the Senate bill and then asking the Senate to conform the House bill.
So as Chair Bagnall said, you have already heard the House crossfile. This is a departmental bill from the Motor Vehicle Administration that would add the administrator of the MVA as a member of the Cannabis Public Health Advisory Council. So that bill has passed HGO in the House. The difference between the Senate crossfile is that the executive director of the Office of Social Equity in the Maryland Cannabis Administration is also added to the council.
And do I have a motion on the bill?
Move the amendment.
Or I don't think it's an amendment because
it's not an amendment. So this is the Senate bill as amended.
Thank you. It's been all right. It's been moved and seconded. Any discussion on the Senate bill 222 with the Senate addition of the Office of Social Equity? All right, all in favor say aye.
Aye.
Anyone opposed? Go. Thank you, Brian. Delegate Chisholm. Anyone opposed? Go ahead and raise your hand in the chat. All right, it passes unanimously, and we will ask that the Senate conform the House bill with the amendment that came over from the Senate. Our last bill today is Senate Bill 157. This is the Maryland Disability Service Animal Program established. We heard the House crossfile earlier in the session. We had the hearing on the Senate bill, and we do have Senator Simonaire who is here. I believe that there was an outstanding fiscal note, which I believe that Senator Simonaire has been working to address. So let me turn to Erin to talk us through the bill and the proposed amendment, and then Senator, if you want to talk to us about the work, and we'll open it up for discussion.
There's a reprint that was emailed to you all that incorporates the amendments that are being proposed by Senator Simonaire and also Delegate Lehman on the corresponding House bill. The bill establishes the Maryland Disability Service Animal Program in the Department of Disabilities to refer eligible individuals to selected nonprofit training entities to be paired with an appropriate service animal. MDOD must select at least one nonprofit entity that meets specified qualifications to carry out elements of the program. A nonprofit training entity may disqualify a program participant under specified circumstances, and a program participant may discontinue involvement in the program for any reason. The bill also establishes the Maryland Disability Service Animal Program Fund to pay a nonprofit training entity and cover the costs of administering the program. If you look in the reprint, the amendments attempt to bring down the fiscal note by streamlining the requirements on DoD and also the required funding element. So if you look on bill page 3, an eligible individual is limited to a resident of the state with a disability. And then on to bill page 4, the purposes of the program are streamlined to strike the requirement that MDOD refer eligible individuals who inquire about participation. Instead, they are just required to select one or more nonprofit training entities to participate in the program. It also strikes the requirement that MDOD encourage successful program participants to assist in outreach and referrals. Further down on the page, it strikes the requirement that the department manage and supervise the program. Instead, the department is required to administer the program. It also streamlines the regulations that the MDOD is required to adopt, in that they are just required to adopt regulations that implement the program and not to ensure that the fund resources are utilized to carry out the purposes of the program. Furthermore, the requirement that the department promote the program to eligible individuals through outreach and refer eligible individuals to selected nonprofit entities is struck. And then if you go to the last page of the reprint, bill page 7, after line 2, this speaks to the funding, and it requires that for each fiscal year, the governor include in the annual budget bill an appropriation of $25,000 to the fund. And then there's contingency language stating that the act is contingent on DoD certifying that they have sufficient staff to administer the service animal program. And if they determine that they have sufficient staff, they would notify legislative services that they do have staff, and then the bill goes into effect.
Thank you very much, Erin. Senator Simon, do you want to talk to us about the proposed amendments?
Yeah, I think Erin hit the highlights. The other thing is, after a year and a half, if they don't have sufficient staffing, then the bill is sunsetted. We had to get the fiscal note down. I talked to Delegate Barnes, and he said, even if it's not correct what's in the fiscal note, they have to go by the fiscal note. And so the fiscal note assumed we were going to have the same level as we did in the veterans program, which has been running for 8 years, and it's been expanded several times. The intent is to start small, get it working like we did with the veterans program, and if they want to expand later, they can. I shared it with the department. They're good with the amendments as they are now.
Okay, thank you, Senator Simon. And I see I have a question from Delegate Hill.
Thank you, Madam Chair, and Senator, thank you very much. Just a quick question on, I guess it's page 4, under 71203, lines 14 through 16, where it had said refer eligible individuals who inquire about participation in the program to to one or more nonprofit entities. It now says to select one or more nonprofit training entities to participate in the program. I'm not sure how that changes the fiscal note, so I was just curious about why that change is made. Does that narrow down so that maybe only one?
Right. So
I'm wondering about whether that gives favoritism to some, well-known group, and other groups that want to participate might be excluded the way it's written now.
right. No, that doesn't change that. They can do one or more. That is the way the current program works in the veterans. So if you only had one, it would work, but you can get more as well. We expanded to the horse therapy with them, and they wanted to work with one initially to get it working, and then they expanded it further. So it just gives flexibility to the department.
All right, thank you.
Thank you. Thank you, Delegate Hill. Do I have a motion on the amendments?
So moved.
Second.
All right, they've been moved and seconded. Any further discussion on the amendments? All in favor, say aye.
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 Anyone opposed, go ahead and raise your hand in the chat. And do I have a motion on the bill as amended?
amended.
Second.
All right, it's been moved and seconded. Any further discussion? All right, all in favor, say aye.
Aye.
Anyone opposed, go ahead and raise your hand in the chat. Thank you very much, Senator, for your work to address that fiscal note and to serve our Maryland folks. With this,
The
Delegate
only other
Bagnall?
thing is the House bill. We'd like to move the House bill.
Yeah, you need to move the house.
yes, thank you. Thank you for the reminder, because I actually wrote myself a note and then I looked right past it. So
We move the
we
amendments on the
also,
House bill?
yes.
You would do
So
that.
we're gonna, so this is House Bill 384. So if I can have a motion on the amendments for
The
House Bill
amendments on the
384.
House bill.
Second.
All right, and any further discussion? All in favor, say aye.
Aye.
Anyone opposed, go ahead and raise your hand. Now on House Bill 384 as amended.
Move the bill as amended.
Second.
All right, it's been moved and seconded. Any further discussion? All in favor, say aye.
Aye.
Anyone opposed, go ahead and raise your hand in the chat. All right, so both Senate Bill 157 and House Bill 384 are passed unanimously as amended. And Aaron, do we need to request another fiscal analysis?
I'll just do a quick, I'll run it by our fiscal staff, like unofficially, but I think it's pretty clear.
Okay,
But I'll also flag for appropriations.
perfect. Thank you very much. That concludes our work for today. Thank you all for getting here and for all of your hard work and for making yourself available and flexible. Take your patience pills and take your vitamins. Drink lots of water. These next week and a half is going to be it's going to be a bit crazy, but we'll get through it. So thank you so much. And this concludes our subcommittee. Enjoy the rest of your morning, and I'll see you